If you or someone you know is struggling with the effects of type 2 diabetes and seeks a completely different approach that can reverse this disease, then the next 30 minutes could change your life. Today, Dr. Marc Ott and Dr. Heather Carter from Integrative Health of Orlando will join me to discuss a new approach to treating type 2 diabetes, one that's literally changing lives. If you or someone you know is battling this disease, you don't want to miss today's Better Health. Thank you for watching. I'm Meredith Galeano, and today we are joined by Dr. Marc Ott and Dr. Heather Carter from Integrative Health of Orlando to discuss the success they are having treating patients with type 2 diabetes right here in the Orlando area. Also, throughout the program, you will hear from several patients whose lives were changed after they began these cutting-edge treatments. Doctors, thank you so much for being with us today.
Thank you.
And tell us why you think that this disease is so rampant in our society today.
I think it's really a loaded question because there are so many factors at play. The reality is, though, is that there's a ton of misinformation out there. Patients are in a position nowadays with information overload. You know, there's information at your fingertips, and quite frankly, very little of it agrees with one another. You know, they go online, they read a book, they're looking for all these different things, and what they find is they'll read one diabetic diet and then read another one, and both of them tell them to do completely different things. They're just not getting information that ever matches up and gives them any kind of confidence that they can do it, or they try one thing and it doesn't work for them, and so they say, you know, I've tried these diabetic diets, I've tried that program, I've done that process, and it hasn't worked for me. You know, I'm not getting anywhere.
And they're probably hearing a lot of different opinions from friends and relatives, people that aren't really well versed in what this disease is really all about.
Right, exactly. And that's one of the biggest problems, is that there are a lot of different types of advice, different opinions out there. And as Dr. Ott said, there are all these different diabetic programs too that they're trying to follow. But those different diabetic programs, they're not going to work for everyone. So you need to, the patient needs to look at exactly what's going on with them, and they need to get treated as an individual. And the biggest issue too is that once that patient is diagnosed with diabetes, a lot of them don't even believe that they can get well. So they just believe that they're going to have this disease forever. So they're not even working on it. They just kind of take that as it is and believe that it's never going to get better.
And are some people sometimes in denial that they even have this disease?
Yeah, I mean, that's really a frequent thing that we run into is, I'll sit down with diabetics who are kind of like, yeah, my doctor said I have diabetes, but I'm not really sure. And diabetes is not something that you either kind of have or don't. I mean, the labs are pretty objective, and you either do or you don't. But I think patients, don't want to accept that because they feel that it is a life sentence. They don't want to subject themselves to that problem. And they bought the genetic thing that it's in my family. My mother had it, so I'm going to be stuck with it. There's no way that I can ever get rid of this disease. And so they really, I think, throw their hands up and almost feel defeated, like a prisoner. They can't really ever get released from it.
Mm-hmm. And a lot of times too, when they have the disease, and if maybe they've been diagnosed from their doctor, but yet they're not going to start taking care of it or start taking the steps in the right direction till they start presenting with symptoms, till they start having the pretty serious advanced symptoms of diabetes. They have the neuropathies or their vision starting to change or whatever it is. Mm-hmm. And at that point, it may be too late. Sure. At that point, they may not be able to turn it around, so they're just ignoring it until they're actually presenting with a symptom.
Well, that's very interesting. And when we come back, the doctors will be discussing conventional treatments of type 2 diabetes. So stay tuned. We'll be right back.